What if feeling like yourself again wasn't about a prescription, but about a playbook? Today's guest builds health on sleep, nutrition, movement, labs, and recovery. Dr. Gary Schliffer, next on DocStars.
Welcome to DocPod's DocStars.
Hello, everyone. I'm JJ, and welcome to DocStars on the DocPod channel. Today's guest is Dr. Gary Schliffer, an internal medicine physician and founder of Evolve Healthcare in beautiful Los Angeles, California. He's also known for a lifestyle-first, preventive-driven approach to metabolic health, men's health, and one of my favorite things, if you tune into DocStars a lot, which is longevity, which we're going to talk a lot about today. He blends conventional medicine with nutrition, fasting strategies, strength training, sleep optimization, which I'm a big fan of, and evidence-based recovery tools to help patients fix the root causes of insulin resistance, inflammation, and hormonal dysfunction. So Dr. Schliffer also created the Sapien Movement and hosts the podcast. Dr. Schliffer, welcome to DocStars.
Thank you so much, JJ. That's a very nice summary. Thank you so much.
Whenever I read that summary, I had a doctor a couple of days ago. I read, he goes, "Is that really me?" I said, "It is. Trust me, I've done all the research. You know, we don't always think of ourselves like that, but it is you, and it's great to see you, doing some of these amazing things, and that's why we wanted to bring you on today." So,
thank you so much.
Let's get started. All right. So, what I was learning when I was doing my research on you was a lot about lifestyle-first operating systems. And this is interesting because my wife and I, we approach this in such a similar fashion. And that's why I wanted to dig deeper on this as well. Foundations, if you will, before prescriptions, the whole kind of N=1 framework. It's personalized, the approach to care, treating each patient. Give me your thought process behind how we break that down so people listening today understand what that means.
Well, let me say how I got to this point. So,
Sure.
I was trained, I went to osteopathic medical school where I didn't know, but I got exposed to a lot of what we call alternative approaches to medicine. At the time, it was sort of confusing. I was kind of against it in a sense because I really wanted to be a traditional physician. I went to residency at Indianapolis at IU. And it was very traditional and very by the book, evidence-based, and I loved it. I learned a lot. What I didn't like was that I didn't make anyone healthier, ever. I don't think through medical school rotations, residency, and then I worked in the hospital for a few years, and never did I make anyone healthier. I just bandaged things and prescribed stuff and followed some recommendations, and everyone was like, "Oh, you're doing a good job." But I didn't feel that I was doing a good job. It didn't feel right. I was inspired to change my entire approach when I started thinking through the lens of evolutionary biology. That's where it comes from for me. I think a true physician, a true healer is using many different modalities to think about how to help someone. And when I say modalities, not treatment modalities, I mean evolutionary biology, anthropology, traditional Chinese medicine, traditional alternative stuff. I listen to bodybuilders and how they navigate their physical health. To me, there is so much information and knowledge to integrate to really help someone that it's a constant process of learning. And when I look at a human being through the lens of an evolutionary biology, of course, lifestyle medicine has to be the cornerstone of it because we evolved on this planet to be the alpha species. We are well adapted to this world. We're very good at surviving and thriving. So when you see chronic disease over the last 100 years, just ravage through our societies, and it continually get worse. And despite all of these medical interventions that we come up with, people don't get better. It made me think, I'm not doing it right. I wasn't trained correctly. I was trained to service a financial industry that we call healthcare and not actually heal people. And I recently, everyone has probably heard this, but originally medicine was an art, then it became more of a science, and now it is just a business. And that bothers me. Now I embrace it because I am a businessman after all, and I have many companies, but those companies are anchored in helping people and not just making as much money as possible. So I try to go back to the art of medicine because science is very useful, but the human body and the human condition is very complicated. And I don't believe science will ever have it perfect. I think there's something to be said about the spiritual part of taking care of people. I think there's something to be said about the interpersonal relationships, or at least understanding what someone's goals are actually, and not imposing myself on people. So that's why I believe so strongly in lifestyle medicine. To me, it's not even a belief, it's just the only way to help someone.
Yeah, and I'm glad you framed it that way because it makes so much sense. You know, you're in this space every single day. And I spoke with the chief of lifestyle medicine, I think it was at Rush Presbyterian. And that was just a couple of days ago. And we talked a lot about this. And so, again, I think it's so interesting. My wife and I, we talk about this all the time, you know, how sleep, nutrition, movement, some of these really core principles, right, are so important. And so let's talk about that. If a new patient arrives, for example, with fatigue or abdominal fat or borderline A1C, these types of things, these types of symptoms, I should say, you know, what are you thinking in terms of your first protocols when you see a patient? So people listening to understand what this looks like for them.
Well, I asked them one question: what is your goal here today? Because at least in my primary care clinic, I'm not a cash pay integrative practice where only integrative and lifestyle people come to me. I'm popular for that, but I have all comers, right? People that find me through
Mm.
insurance, people that find me through Yelp or Google, people that heard about me through a family member, whatever. So I believe strongly that if you're going to help someone, you have to meet them where they're at. So no, I don't dump my carnivore or fasting or let me tell you about sauna. I don't impose that on people. I like people to come asking the questions and being interested. Otherwise, I'm wasting my breath. So, frankly, I ask them what their goals are. And if their goal is to practice lifestyle medicine, if their goal is to do something different than what the doctor before me offered them, if their goal is to get a prescription for a drug, as long as I think it's safe, I will give them the prescription. Like, so I'm not even against all that. I think you got to, because sometimes, like, I've had cases where someone came to me, they're just like, I'm here for an antidepressant. And I'm like, well, there's a plethora of other ways to manage your anxiety and depression. And they're like, well, I'm here for that. And I'm like, okay, here you go. I think this is the best one, best side effect profile. It fits you as a person. I think it's the safest. This is what to worry about, blah, 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 blah. And through just a normal interaction with a human being, I try to build a rapport and a trust and an understanding so that maybe on future visits, they would open up to some of our lifestyle practices. More and more people are getting savvy to the lifestyle approach. And so more and more they sit down and my goal is to change my lifestyle. And that's fun. And that's where I smile and I get into it, you know. Now, of course, very very challenging in an insurance-based model to spend a bit of time. So I've developed, obviously, my podcast is a big part of. I did that not to make money or to become popular. I did that to create a resource for my patients. I used some really smart medical students and residents that rounded with me to create some literature that I haven't published publicly yet. I use it in my clinic. Maybe one day I'll get around to it, but it's all like an evidence-based explanation of the sapient diet and lifestyle, which is essentially a whole foods-based, approach to normal evolutionary based lifestyle. It's what we're all talking about. I just named it something because when I started it about 7 years ago, it wasn't quite so popular. Um, and so I try to find what will trigger the initial transition. So, meaning some people are ready to go over their food diary and their food eating protocol and get into the nitty gritty. I've had patients day one that are interested in that. Other people are just like, wait, red meat is good for you? Wait, I can eat eggs. There's such a different, wide range of where people are, where you're meeting someone, that I don't have a go-to protocol. I mean, I have go-to protocols, but I don't impose that on someone. I let them show me what could be most useful. And another thing, at least in my practice, because we're limited on time, I'm like, look, if you want to make a difference, you're going to have to schedule frequent visits with me. Maybe your last doctor will see you once or twice a year, and sayonara, here's your refills. I'm like, if you want to make a change, I'll see you every month. That I love it. I love seeing someone every month. I wish I could see someone every week. I wish it was a financial model that I could spend an hour with everyone and do all and brain dump all my stuff. I would love that future. But right now, it's all about introducing them. And then what I've also done is I've trained a bunch of mid-levels. So a lot of people in my position will hire nurse practitioners and PAs,
Hmm.
and let them just practice. So I don't do that. If you work for me, you've spent an ample amount of time learning from me, seeing how I do it. If you don't like how I do it, it's time to find another job. I I do it my way. It's okay. It's not for everyone. I don't, it's fine. There's millions and millions and millions of people. You can go find other doctors to work for. So by building a team that's, aligned with my perspective, there's continuity across visits with other providers. And I think that is probably a unique and special thing, and is taking an exorbitant amount of energy to train these people. And I'm very proud of that, because I, again, don't make any money on that. I do it because I think it's the right thing to do.
Which is amazing to hear. And honestly, Dr. Gary Schliffer, and I'll say Dr. Gary from this point on. I like that. It's easy if you don't mind.
I
Uh,
love it.
there's so many of us that I think, and I'm not a doctor. And, one of the reasons when we started this podcast, many people said to me, oh, how can you interview all these incredible doctors, these healthcare leaders? You're not a doctor. I said, because I'm just a normal person. And I think sometimes when I used to listen to podcasts with a lot of doctors, and you probably know this from your own podcast, they were using a lot of words and concepts that were way above what any of us understood. And so I kind of tuned out. And so I think what I try to do here is really distill it down and take these difficult concepts, right, and say, listen, okay, how can I apply them, for myself, my wife, my friends, my family, and anybody that's listening? And I think you made a great point, which is when you first go to the doctor, and I find it increasingly that they have less and less time for me. When I go there, I see them looking at their watch sometimes, and my primary care provider. And I literally switched my primary care providers until I could find someone who was going to make a little more time. And I would come in with information about, the way I'm living my life. I had some biomarkers, the way I eat, I sleep, all of these things. And I just wasn't really getting anywhere with that particular doctor. So for yourself, being a doctor, would you tell us it's okay? Keep going until you find that primary care provider or that doctor like yourself who is going to listen and understands this side of, this holistic living and lifestyle medicine, that sort of thing. Does that make sense?
Yeah, it does. I don't know what other doctors are doing. I say this all the time. I live in my own world. I find my colleagues on as a whole to be disappointing. I have a
Mm,
small group of trusted specialists that I work with, and I've, at least locally, never met a primary care internal medicine doctor that does anything similar. That's not, again, I again live in the insurance space. I don't know if maybe if I lived in the cash-based space, it would be different. But at least my mission is to not ostracize people that cannot afford me. That's been an important part of what I do. I spend a lot of energy making money in other ways because you know, but at least for now, my mission with Evolve is to make a very high quality product that is the closest thing to that expensive integrative medicine visit, uh, for a normal insurance patient, right? Now, I don't take like the Medi-Cals, the state insurance, because they literally pay $15 a visit, and that's not
mm,
feasible. But I've made it work so far, with just like Medicare and PPO insurances, which is what most folks have. And is it perfect? Is it exactly what I would love it to be? Can I sit there and go through every single protocol and really maximize an hour? I don't have that much time. So it's a compromise that everyone must face. So if you're asking what a person should do, um, the doctor should meet you where you're at. And if they're not the most knowledgeable person, all of this information is available everywhere. I have podcasts. There's other brilliant people that have podcasts. You have this awesome podcast. People can learn from you. I have a book list. I give people books like, hey, I didn't learn this in med school or residency. Here's the books I read. Read. Or better yet, listen. Or better yet, find the author on someone else's podcast and they'll give you all the secrets in an hour and a half. People are sharing this information. The information part is easy. The hard part with the doctor is if they're not understanding what you're trying to do. So many of my patients come to me because their doctor is imposing, most commonly, like a statin, right?
Mm.
And this question of a statin keeps coming up, and I'm like, look, if your doctor is fear mongering you that you're going to get a heart attack or a stroke because your LDL is high, that's not real. That's a red flag. If your doctor's like, look, I think you should be on a statin, I strongly believe it'll help you. But if you don't want to, let's do the other things that can help make you healthy. I think that's okay, right? I think the doctor doesn't have to be the end all be all of information and everything. They just need to be your partner in this healthcare journey, right? They need to support you and respect you and not impose on you things that you're not into. So,
Exactly.
yeah.
Yeah, no, go ahead.
Yeah, so I mean, I think most doctors want to do that for patients if they're in a very overwhelmed situation where they're seeing way too many patients, they're just burned out, and I think that's probably not someone you should be seeing. And moving towards clinics and practices that respect their providers enough to let them be nice and courteous and have a little
Hmm.
bit of time. You know, people used to say, oh, you need 30, 45 minutes, 50 minutes to do something. Like, I got good at it. I need 7 minutes and my patients feel great because I figured it out. It took me a long time. It's not that you need to give them all the time in the world. It's that you need to meet them, understand them, give them resources, give them a roadmap, and then be there for them. And I don't think it takes all the time in the world because I don't need to sit there and teach them everything about low carb or intermittent fasting. I just have to have those resources. So that, I think, is a simpler solution on scale for the whole system to adapt. These resources should be available, right? It shouldn't be that every time you go to a doctor, they just show you the standard American food
Hmm.
guidelines. They should have like multiple, like these agencies, these three-letter organizations should have, well, here's an option for pescatarian. Hey, you like low carb? You think that's a good approach? Here's what that looks like in a healthy way. Hey, you like intermittent fasting? Here's some important key strategies and factors to consider to do it safely and not hurt yourself. Instead of saying, oh, no, 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 we don't know about that. We have the standard American diet. Or, hey, I believe that a plant-based diet is good. Here's a vegan book. Like,
Mm.
you're missing the point, right? I don't only see carnivores. I see vegan patients. I see people that just want to just want to exercise. Like everyone's different, I just think
Hmm.
that we have not I finished all that training, very high level, got board certified by the American Board of Internal Medicine. I did all this really high level stuff, and I had no tools to help my patients
Mm.
be healthy. Like nothing except for pharmaceutical practice, which, granted, as an internist, I'm very good at pharmaceuticals, I'm very grateful for that education and experience because it makes me good at it because there is an important role in pharmaceuticals and medicines, even non-pharmaceuticals, psychedelics. I've learned about even substances that are illegal because people are going to go get it. I want to know about it. I want to make sure you're doing it safely. Like, I used to not understand anabolics, right? And I had so many
Hmm.
people using them. And I'm like, look, I'm not going to sit here and poo poo them. I'm going to understand it and I could give them some guidance. Like, hey, these are the side effects. At least let's screen you for these things: heart disease, prostate disease, cancer, a more aggressive cancer screening regimen if you're on these aggressive substances. So it's about really accepting that people are different and building a toolkit. And you know, there was a dream to have a Sapien be like an education center for doctors.
Mm.
I don't know. It's very challenging. I know a lot of people have tried it. I've really gotten frustrated with my colleagues, just to be honest with you. And I'm not interested in them anymore. At least that's my position. I'm not interested in trying to convert other doctors. I'm interested in meeting like-minded folks and working with them. I'm not going to convince you that all of those recommendations were but biased, bogus, and driven by dollar greed and whatever historical issues created what we have now. I'm just going to do a good job for people that want my help. And if you show up and you don't want my help, it's all good. Like it's all
Yeah.
good, you know? Because maybe in a year, if I'm nice to you, maybe you will want my help and then I could really help you. And that's okay too. We all take different
Yeah.
amounts of time to get there.
Yeah. And actually, you said something which I really like, which I say all the time, which is it's a partnership, right? And you have
Mm.
to pay attention to your own body. You have to advocate for yourself. You need to do some research. If I just walk in there and I don't know anything and I can't tell you anything about my lifestyle, how I'm eating, I'm exercising, all these things that I should be paying attention to as well, because we bear the responsibility as well as the patients, right? It can't all be on you guys. And I think that partnership is really important. Also, what I hear from you is that there's a balance here, right? Between, pharmaceutical medicines and lifestyle medicine in terms of having a balance of eating healthy, moving, focusing on all these little things. And so, yeah, it's something that we just have to drive the narrative more, that we need to be more proactive. And that's what I love about what you're doing is, if we can be more proactive, because early on it sounds like you were just treating things where we already had a situation, but so many of these things we can be proactive with. And I think that's what lifestyle medicine really dives into, and that's what I've learned, and I think a lot of people are understanding finally.
Yeah, I mean, I think it, I meet people right. This is like really common. I meet people right before they're about to be really sick.
Oh,
Like I
really?
have so yeah, I have so many guys that are like 45 to 55 whose wife finally made them come in and I'm like, "Man, are you lucky she brought you in?" Cuz you're right there. You're right there. Your A1C is right there. You know, your HDL is plummeting, your insulin's high, you're going to be type 2 diabetic soon. All of these rashes you're getting are autoimmune related from all the garbage you're putting in your body. This back pain you're complaining about, like you haven't exercised in 3 years, like what fantasy world is it that your body doesn't break down if you're not using it? So that's a fun place to start because they have a little bit of fear and a little bit
Hmm.
of like something to motivate them. I also meet people who are too far gone, and that's
Mm.
another thing people don't realize. I meet these like 70-year-olds who are doing all the stuff. But look, they have plaques everywhere. They have peripheral vascular disease, cerebral vascular disease. They think that they're going to fast and clean up their diet and go for walks. And in a year, it's all good. And it's like, well, no, no, you've destroyed yourself for decades and you just had a stroke and you need medication because you're going to have another stroke. And then they're like, well, I don't want it. I'm like, fine, you don't want it, but I have a lot of research to suggest that these medications will prevent this disease. But I'm fixing it. I'm like, you're not fixing 50, 60 years of disease. That is also a fantasy. And I don't like it when people online sell people that fantasy that
Mm.
if you just do this for a year, you're fixed. No, no, not everyone. Some people have been running an A1C of 10 for the last 5 years, and they've got significant retinopathy. They've got nephropathies, so eye disease, kidney disease.
Mm.
They're sick. Okay, you're sick now. You are. And you know what traditional medicine is pretty good at? Bandaging that. So let's bandage it instead until you lose your vision or you end up on dialysis because that's crazy. So
Mm.
I'm giving some examples of where you meet people, like you meet people in these different times and places in their disease processes, and everything is not a one size fits all. Can I give you some fun examples from I did
Yeah.
25 patients in my clinic yesterday. I had this guy who started following all these doctors online and found me because I'm in that world. And he's like low carb, intermittent fasting, grass-fed beef, pasture raised. They're growing their own chickens. I love all of it. Okay, I love it, right? So that's been like 2 years. So he shows up yesterday and his liver numbers are super elevated. His blood markers look funny. And I'm like, what's going on, man? We've been rocking and rolling. You look great. You're feeling great. He's like, well, I don't know. I heard this guy and he's like, I'm gonna eat this chunk of frozen beef liver every morning. And I'm like, what? Why would you,
What?
what? It doesn't even make sense. It doesn't make sense. So there's people online in our community of lifestyle medicine leveraging it to make dollars and promoting things they don't know what they're talking about. I don't know. Some of you might that are listening, I don't want to call him out, but some of you might know. And I had some people on my podcast and I call them out and they get upset. They get upset when I say to someone that a carnivore diet is a therapeutic healing modality that should not be done indefinitely because it's hard on
Mm,
your body to be in chronic ketosis. And you're supposed to expose yourselves to carbohydrates so you could spike your insulin and grow your muscle. Because if you never spike your insulin, that's also not good, right? So it's not
mm,
just black and white. And so these people, they get stuck on one piece of lifestyle medicine, uh, cold therapy. Some woman,
mhm,
oh, women should do cold therapy. Okay, it's good for you. Well, not every day. It's really hard on your hormones. And a woman has a monthly cycle that's dependent on an active phase, an ovulation phase, a rest phase where you can't put yourself through ice cold water every single day. It's going to destroy your hormones. This is obvious, by the way, right? But
mm.
when you make money selling cold plunges, or you make money selling this like lifestyle brand that's based around these like few pieces of this whole story, it misguides people. So I think that's where physicians, health coaches, people that truly are in the world, like not making money off part of it, but really understanding how important the entire approach of lifestyle medicine is. When you have those people guiding patients and they have these fun resources online, because I'm not poo-pooing those resources. I'm just saying that is not, there's no one size fits all. And there is no like, just do this every day and you're going to be great. That's not life. Life is not just do one thing every day and everything's great. And unfortunately, the business of medicine makes it very hard to to navigate, a truly healthy approach to lifestyle.
Yeah, and I think exactly what you said at the end is the most important thing that we see because I lived outside the US for 20 years. And when I came back into the system, I was in 4 different states for 4 different years with my wife, jumping in and out of different healthcare providers and even used Obamacare and some of the healthcare.gov in between. And it was a real eye opener, because it really is revenue driven. And we could do an entire podcast, obviously, probably many, as we know, just on that. But I think to your point, we have to look at the details because all the time we see, oh, do cold plunge, do get some additional heat, hit the sauna, have 5 pounds of red meat. And like you say, first of all, it depends on the person, right? We're all built differently. So individually, we have to look at what our biomarkers are, understand maybe we have a predisposition to something. We need to understand that, right? And then also, what I'm hearing a lot is the details do matter. So yes, cold plunge probably can be good once, we go to a doctor like yourself, you understand our situation, but for certain periods of time, you can't just say do it every day for tons of hours. And I think that's where a lot of this gets lost. The idea is, yes, you could do some of these things that'll really help you, but the details matter, right?
The devil's in the detail, right? It's all of that. It's all of that. And um I think we're going through an evolution as this kind of I've watched it go from nothing where there was like one or two people online talking about it to an entire community in Austin, Texas where everyone flocked there and it's like a world of people living this life. How beautiful. Um to, 70-year-old women that show up and they're like, "You know what? I hear it. I hear it. I want to try some of this stuff, you know. It's something I never, 5 years ago, 4 years ago, never, ever did I see seniors coming to me, asking me about stuff like this. So it really is rapidly evolving. There's other great things. You're talking about money, right? It's not all negative. Like, I'll
Mm,
make an example. I used to have a hard time guiding people what to buy in a store, right? Because
mm,
it's hard to find good products. Over the last few years, you have brands like Siete pop up, a family company out of Texas that creates best in class chips and marinades and seasonings, and how fun. Now they got bought out by a big company for like $1 billion. I think Pepsi bought them. And they're not changing the ingredients because they don't care if it makes you healthy or sick. The companies want to make money. So
yep.
if this product makes you healthy and this product makes you sick, they just want to see you buy it, and then they'll sell it to you. They don't care. It's not, there's this idea, oh, they're like some evil geniuses. No, they're not evil geniuses. They're just trying to get paid, right? Now, are these big companies creative? No, they're not creative. They don't have people that are passionate about healthcare or healthy living. But they will see a company like Primal Kitchen
Mm,
that made best in class marinades, dips, and all that stuff. And they will buy them out and then not change the recipe because they know that that's why people are buying it. And they will then increase the distribution and put them in many more grocery stores than they were before the sale. And now everyone can go buy ketchup without sugar, or, dressings made of fruit oils instead of vegetable oils. Like, it's out there. So the money's not also bad. It's just it's evolving. It's evolving in real time. So, I think it's like a fun journey to be on, but it's very confusing to the end user. That's the
yeah.
problem. It's like super confusing. And then you
Yeah.
have these battling, opposing ideas of like plant-based or animal-based, which is a bogus argument because plants and animals are good for you. And that's like not the point at all. It's about processing and quality and fillers and, chemicals that are added to stuff that are bad. And so
Yep.
it is that the details are not as simple. Like, we say this high level stuff, but when you get into the
Mm,
nuance of every food type, and I do this, and this is like my favorite part is when a patient comes in like, okay, I got this dressing, I got this seasoning, I want to cook this, and we get into like, how do you do that in a healthy way? I'm a big fan of Bobby Parrish. I think he does the
hmm
best version of this, Flav City. He does great video content on how to go shopping and how to cook. Now he makes really amazing products, so I couldn't be a bigger fan of his. He taught me so much. So, it's this evolving community, and I love watching it evolve. And I'm trying to be a part of it in whatever way I can. For me, it's been really hard to do the social media public thing because I'm not good at like just pursuing dollars. So I got to do my business. I got to make sure my employees are happy. I got to make sure my patients are happy. I got to make sure I'm moving the ball in my world. So I've become increasingly insular. It's true. I've even let go of my podcast. I did about
mm.
50 episodes. I did like 35 episodes on food, which I just had a patient. I have patients all the time. Like, I just listened to every episode of Sapien podcast that you did. Thank you so much. I had a guy here yesterday, 40 pounds down in 6 months. Biomarkers are improving gradually. Everyone in his family is blown away coming to see us. It's so flattering. I did a bunch of episodes on hospice and palliative care, which I'm passionate about, psychedelic medicine. I brought in all these alternative providers like reflexologists and psychedelic therapists and bodybuilders who do hormones for people and help with training. And I did all that. And then I said, you know what? I can't right now. I have to focus on the people in my direct influence, in my direct sphere of influence. It's getting scary to me online. It's really weird and competitive. If I want to get popular and make it a viable business thing for me, I have to play this dirty game of like anchoring on to some weird thing that people like to click on. I don't want to do that. So that is a tricky part as this community grows and it becomes more popular. And we all have to make a choice of what we're gonna do about it. So I'm not doing my podcast anymore until I can figure out a way that it makes more sense. But my podcast exists for my patients and for the people at large to learn because the things I talked about aren't going to change. They're
Yeah.
foundational health principles. And I'm really proud of that. And I'm curious to see where it goes in the future. And that's why I do fun podcasts like this one, because it's important that people hear this. But
Yeah.
I don't know exactly where I fit into it anymore.
Yeah, I mean, you bring up a lot of really interesting points. And I think the hardest thing for people listening, especially when you're younger, but also even when we're older today, is there's so much misinformation, Dr. Gary, that there's just so much out there. It's hard to find that signal amongst all the noise, right? And exactly to your point. And, I always bring up Charlie Munger because I'm a big finance guy as well. I love financials to dig into all that. And his great quote was always, show me the incentive and I'll show you the outcome. And so we've seen that in this field for so many years. But I think now, when I was younger, I was only in the sphere of hearing from my doctor or maybe a friend's doctor. And that was before the internet. And now you see it today, and we're just bombarded with every piece of information. It doesn't matter if it's a board certified doctor, if it's really evidence-based, if it's all this, truth that needs to be out there. And I just think it's very challenging. So with that said, my wife and I, she always tells me her diet and our diet together, our lifestyle, I don't even want to use the word diet, but our lifestyle is back to basics. And I want to get your thoughts on that, which is really, and we've been doing this for about 15 years, which is just based around moving, getting the right amount of sleep, eating whole foods, primarily vegetables, whole grains, fruits, but we eat chicken, turkey, and some red meat as well. And I'd love to get your thoughts on just understanding a well-balanced kind of simple diet, because there's so much information we're bombarded with. And I want to get your thoughts on that.
Yeah. Well, so just diet or like big picture lifestyle?
Big
Maybe
picture
big picture lifestyle.
lifestyle. Yeah, exactly. Yeah, I shouldn't use
I
the word diet,
think
but big picture lifestyle. Yeah.
I actually think that the number one most important thing you can do for your health and longevity is sleep right. I think that supersedes almost everything else.
Mm,
I, 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 there, everyone, or if you haven't, Dr. Matthew Walker, a very convincing argument for this. Why We Sleep, excellent book. Um, I think that the restorative nature of quality sleep, I think the focus on an evening routine, a comfortable sleeping environment, a morning routine does so much for your overall health. And it allows you to build a nutrition approach that makes sense for you. It allows you to train, whether little or aggressively, and actually achieve those goals. So foundationally, I think you've got to fix the sleep part if that's a problem for you. If you have sleep apnea, if you're not sleeping and you've not been assessed for sleep apnea, I think it's critical. If you're not creating that environment, obviously, if you can, where you can really shut it down and really get into good sleep. If you need like an aura ring,
yeah.
meters or
Some
something
measures.
to
Yeah.
think that, like something to give you feedback so you understand where your sleep quality is
Mm,
at. So I think that's foundational. I think, and of course, you can't decouple it from like to sleep well, you have to eat right and you can't eat too late, whatever. But to start with that idea first. And then when it comes to food, right? Look, whole foods, what does that mean? Look, I don't think we should be eating chemicals. There's some chemicals that are okay, and there's some that are unavoidable. But every single person that wants to be healthy should be reading every single label of everything they put in their mouth, including supplements, by the way. It
exactly.
maybe most importantly supplements, because the difference between like what I sell in my office or online and something you find at CVS is not usually the active ingredient or even the dose of the active ingredient. It's usually the other ingredients in there. And that's what people are missing. That's why when they're like, "Well, doc, what is the difference?" The difference is everything that's not on the little nutritional label and ingredients
Yep.
label. And that's how they trick you, right? They trick you with that stuff. And they make it really hard to read. And people are like, "Oh, what is this like 25-letter word?" I don't know. Don't put it in your body. Like that's it. Or
Exactly.
nowadays we have a lot of resources. Look it up or come and ask me. I do a lot of supplement reviews in my office because people get
Mm,
overwhelmed. They have 50 bottles and I do like, this is great. This is bogus. Oh, this is interesting. I'll look into it myself. That's how I learn so much, by the way. My patients
mm.
bring me stuff and it's fascinating. Um, it's great. So looking at ingredients, I think thinking about meal frequency. I think this breakfast, lunch, dinner, this bogus idea is not for everyone. That is not to say it's a bogus idea that no one should eat breakfast, lunch, and dinner. What I'm saying is many people will benefit from diminished meal frequency, which we
Mm,
call intermittent fasting. And that's it.
yeah.
And understanding that, you know, 16/8, where you eat for 8 hours and fast for 16 hours, it's a great place to start. But hey, that might not work every day. And that might not work for you. And if you go and eat all the food because you went out with your friends for their birthday or whatever, then maybe you don't need to eat again for 24 hours because you just ate 5,000 calories of food. And you should
Mm,
probably think about what you're putting in your mouth and what that's going to do to you, right? And so it's not
yeah.
like black and white where, oh my God, I'll never have a piece of cake. Look, have a great workout, eat a nutritious meal, have a piece of cake, and maybe tomorrow you don't need to eat until dinner time. And the cake won't affect you negatively. Like it's not so black and white, right?
Yeah.
And simultaneously, it's like just eating a scoop of honey every day because you know you should get carbs is also like not the point, right? So there's a lot of nuance to it, but I think people should think about instead of so fixated on like calorie counting or meat versus veg or something like that, it should be like, let me think about the quality of food. Let me check every ingredient. And if I don't understand what I'm putting in my mouth, don't put it in your mouth. And then let me think about my meal frequency. I've tried to switch to that a little because it's like fasting could be intimidating to people. But if you just think about like how often you really need to eat based on what you ate before and based on what your goals are. If you're about to have a brutal day of work all day, maybe you shouldn't be fasting through the whole day. If you didn't eat
Mm,
enough protein and fat the night before and you spiked your insulin, you might need to have that breakfast. Like you got to think
mm,
about it, right? And then with fasting, it's not all that benign. You've got to make sure you're getting your electrolytes. You've got to make sure you're hydrating. You've got to do it right. You don't want to take certain substances on an empty stomach, which means if you're taking certain medicines, fasting might not be right for you. At least,
yep.
the version that you see online. So I think that the whole foods approach makes sense. I think that intermittent fasting should be a cornerstone. But I think that you should understand your needs. You should understand, like, if I have rip roaring type 2 diabetes, I should probably not eat any carbs for a while. Oh, Gary, but you said that insulin should spike sometime. Yeah, but a type 2 diabetic's insulin is chronically elevated. So let's give
Mm,
it a break. Let's just give it a break. Let's let that insulin find its normal zone. And and,
yeah.
and so I suppose that's that devil in the detail we were talking about.
Mm,
And then as far as exercise goes, the movement piece of it, I think it's something that is very personal, right? I think that some people could go for a hike every day because they live somewhere that's nice for hikes, and that might be good enough, and they're happy. And some people need to go lift and play basketball or they go crazy. Like, I have
mhm.
to. I can't. I'm like thinking about it today. I'm like, I've been too busy. Like, I have to go. And I say this because people think that exercise is just about heart health or weight loss or building muscle. I think it's a spiritual practice. I think it connects us to who we are as human beings. We were, in fact, hunter gatherers that were walking most of the time. We are ambulatory creatures running, and not necessarily like sprinting, which is really great for you, but like going on runs. People are like, oh, don't go on runs. You should just do sprints. I'm like, well, if you're trying to burn visceral fat and your knees can take it, by all means, go do sprints. But if you want to have a calm mind, uh, some connection to the outside world, maybe going for a level 1, level 2 exercise jog, in your community for 20 minutes, that'll get business done for your brain. And it's pretty good for your heart. And it turns out that that kind of exercise actually burns more calories. What? Yeah,
Yeah,
burns more
exactly.
calories. So if you're trying to lose fat, that might be a better strategy. And then when you get to a better weight, then you could do some sprints. So again, I'm picking on some people in our community that try to sell one thing as like the all end all answer. And that is, I think, ultimately where I got frustrated and stepped back, because everyone is just trying to have their little thing that they hang their hat on.
Yep.
And the truth is, most all of them have a great idea that's part of a bigger idea, but it's not the big idea. The big
Exactly.
idea is being a human being. And human beings go outside and they go for long walks and they like carry stuff and they do it with other human beings. They hold hands. Like, it
Yep.
sounds silly, but this is lifestyle medicine. Wake up and,
Yep.
like, you know, I say, like, another weird one that people don't get. I think having an animal like a dog or a cat is life-giving. Well, research suggests that having that kind of a pet extends your life and protects against
Mm.
disease. Lots of research looking into that, and you guys could find it. And there's labs all over the country doing animal studies, not on the animals, but how the animals affect humans.
That's right.
We that's a tool that is underappreciated. Well, during COVID, every dog got rescued because everyone needed companionship. They were stuck at home. Let's remember that that's another way you can manage stress, calm yourself down, build a habit of going outside and going for walks. If you won't do it yourself, you get yourself a dog. They'll ask you to do it. You'll take care of your dog. That dog is taking care of you by getting you out the house and going for that walk.
That's right.
So
That's right.
there's a million of these, right? There's so many tricks of the trade and tricks to do it. But I always come down to the question of, what did we look like for millions and millions of years? Well, we didn't look like these cities. We didn't look like refrigerators and, frozen pieces of liver in your
Yep.
refrigerator freezer. That's not real. That's made up. Yes, we live in a bizarro world where our soil is so depleted, we have to take supplements. So yes, when your doctor says, oh, you could get it in your food, they've done zero research on our current nutritional landscape. That's a person that was sold an idea by a drug and food company that makes them money. So that's another red flag. Back to our first conversation. Doctor says you
Mm.
can get it all in your food. Doctor does not know what they're talking about, because that's not true anymore, unless you live on a farm and grow all your stuff organically and procure your own stuff. And
Yeah.
that's amazing. It's just most people listening to this don't have access to that, right?
Yeah.
So I don't know, long-winded, sorry, but that's where my head is at on lifestyle medicine.
Well, I love it because you are a curious person, I can tell, and you're open, which I think is so important, especially as we get older, not just in, business, where I think it's very important, but also in life. And I think we talk about social connections. That's a big part, I think, of us being healthy and happy when we get older. My wife and I, we tell it to all of our friends. I said, look, for us, it's health first, because without that, it's hard to do anything. So we really focus on our health, but we focus on social connections, relationships, staying curious in life, and just kind of making things simpler. One of the things I noticed when I came back to the US was that the portion sizes that we consume are massive, right?
Yeah.
And we don't eat as huge portions. We might eat more. We do, like you say, a bit of intermittent fasting. We don't have huge portions. We eat a lot of fish. We try to eat healthy. We try to get the right amount of sleep. Now, I do have a question about sleep, because I did speak to, again, a doctor a couple of days ago, and also they ranked sleep as at the very top of that pyramid, right? Of really something that we can all focus on. I think it's almost low hanging fruit. Like, hey, focus on sleep, because I think we all try to push exercise, nutrition, all that's great too. But like you say, sleep is really important. But the question here is it more important to, like we always hear, get 8 hours of sleep, 7 or 8 hours per night? Again, this is different for everybody.
Yeah.
Personal finance is personal, health is personal. But is it more about going to bed consistently at the same time or getting the right amount of sleep? What are your thoughts there?
Yeah, well, the research suggests that going to bed at the same time reinforces the sleep quality, right? So
Hmm.
is that important? I think the research suggests it is, just to create that consistent pattern, because our brains get into a groove, and we've all been there where you lost your groove with sleep and then all of a sudden you
Yep.
can't find it. Um, I think that routine makes for good sleep. So I think morning routine, evening routine, I think creating a sleep environment, like, great thing I heard back in the day when I started learning about this is your bed is for sleep and sex. Don't eat there. Don't
Yeah,
read there.
exactly.
Don't do this stuff. Your brain gets habituated. It's like Pavlovian. Oh, I lay
Yep.
down in bed. This is what I do here. If you lay down in bed and hit your phone, well, now you lay down in bed and your brain gets activated and you got to do whatever you're doing on your phone. So,
Hmm.
habituating your body to create a sleep environment, all the little things, turning the lights down as you get in the evening, getting rid of the blue light. I think wearing blue light blockers is a cool idea. I can't do it. I'm like living my life. I can't wear my blue light blockers every night. I don't know. But I try at least my best to put my phone down. What I certainly do is my phone is very, very low in that like low light mode, so I'm not getting all that
Hmm.
blue light. Around like we sleep at like 10:30, around 9, 8:30 even sometimes. We're going around the house, all those. If your lights aren't on a dimmer, get a dimmer. It makes all the difference. If you're like blasting bright white light through your house and you can't dim it at night, it's not a good look. You need to be able to dim those lights or get a little table lamp that's really dim, cool, or warm
Hmm.
light,
Warm.
something
Yeah.
to just cool, like calm. Don't get into some crazy argument or conversation. Save it for the next day. Pr- Prioritize sleep like it is going to make you live a long time, because that's exactly what it's going to do. It's going to help you live a long time. So if I gave you a pill that was going to give you another 10 years of life, you sure as hell would take it every day, right? So I'm saying sleep and you'll live a long time. I don't know how many years, but it's for sure you're going to live longer and you're going to be more healthy. So I think, I don't think this podcast is to go over everything. I personally
Mm.
think that one of the best resources is Matthew Walker's book. I think if you're not a book reader, he did a 5-episode series with Andrew Huberman.
Hmm.
It's incredible. It's like 5 hours of sleep content. Now, for most people, it's way too sciencey. That is that, two research scientists get going at it. For me, it was amazing. But yeah.
Yeah. What about something when I hear people say two things? We'll talk about biomarkers, which I want to talk about with you because I hear this a lot now. And we've heard it for, where every year, let's say you go once or twice a year, you see your primary care provider and they do some tests and you get to see what your cholesterol is and your glucose and some of these things. But I've seen more and more people going a little bit deeper on that and people saying, it's important that you're intentional and you understand because we're all built differently. It's not a one size fits all, as you mentioned. How important does that play? That'll be my first question. Your knowing your biomarkers, making sure your primary care provider or your physician has all this information, because maybe what I need is different than what you need, right? Based on some of those biomarkers. Is there truth to that, or what are we thinking there?
I think the question is, do the biomarkers change the guidance? And I do think that's true. Yeah.
Yes,
I think that now, most doctors are still stuck in, I'm going to look at your LDL, your A1C, and
exactly.
we're done. I think that's hopefully changing. At least in my world, it's changing. I'm seeing a lot of people use a lot of more sophisticated stuff. There's like without getting too in the weeds, like in just a basic lipid panel, I think the triglyceride HDL ratio is far more significant than an LDL and total cholesterol. That's a measure of insulin resistance. It's a measure of metabolic health. I see healthy people with high HDLs, low triglycerides, and I don't really care about their total cholesterol and LDL. But let's say you do. That's fine too. We now have more sophisticated tools looking at the broken down fractionated LDL, fractionated HDL. And then there's these newer biomarkers like ApoB and LP little a
Hmm.
that we're still learning about. Very useful, very, very useful. And if you, at least at this point, if you want to learn more about those, Dr. Peter Attia does a great job and is sort of leading the charge, at
Hmm.
least in my world, of like understanding them. And what an amazing guy. He doesn't need to change his mind. He changes his mind. Super popular, super famous, super esteemed. And he goes, I was wrong about this. That is a real person, a real scientist. I'm wrong. We're wrong. Like
Yep.
sometimes you're wrong.
It's
It's okay.
okay. Sometimes you
It's
get
okay.
new information, better information. Exactly.
As far as the blood sugar goes, like a small example, like you go to
Mm.
the doctor. I had a patient. She went to Kaiser. Kaiser is like, oh, your blood sugar is fine. I looked at it. She's been running a 6.5 A1C for the last 4 years. She has type 2 diabetes. They put her on metformin. They told her blood sugar is fine. That's crazy. I'll go one step further. I have someone with an A1C of 5.7, just below pre-diabetes. They're, oh, you're fine. You're not pre-diabetic. Just lose some weight. I look at their fasting insulin. It's 25. You're gonna have type 2 diabetes in the next few years when you're fasting insulin. Now, my patients ask for those markers to other doctors and they refuse. And
Mm.
that's crazy. So if your doctor refuses to order blood markers that you are interested in, that's crazy. That doctor does not lose money or gain money clicking the box for the blood work. And being the gatekeeper to blood work is insane. You, as a doctor, should be able to provide people the blood work they want. If they have to pay a lot of money for it, that's on them. I tell my patients all the time. They ask me some stuff I don't know about. I'm like, sure, we'll learn about it together, but I just know I don't control how much your insurance company is going to charge you for it. That's like a
Mm.
common thing people melt down about. And I'm like, well, I know about what I do and I know how to get that billed. But if you want to try this, new one for sure, let's do it. But just be ready for the financial implications. But yeah, I mean, I use
Yeah.
a lot of stuff. Homocysteine's underutilized I've been checking a lot of MTHFR mutations. I believe strongly that there's a lot to that methylation process that we have not even yet uncovered. I'm sitting there kind of actively doing my own research and following the research. It's very interesting.
Yeah.
Um,
Yeah.
so yeah, you got it.
I just want to say about this because I think it's interesting. I did see, for example, like there's a company, Function Health, right out there that goes quite deeper on the biomarkers. I think it's like 105 biomarkers. And I mentioned it to, I remember one of my primary care providers, and they were like, oh, I don't know if you need that. These basic ones are what you need. So I guess for people who don't know it, even when you do your research, there's such conflicting information. When you're looking at stuff like that, I would think that the more I know about my own body, the better. But other people are like, well, maybe that's just a revenue scheme that, they're adding more of these, but you don't really need it. This is the hard part, I think, for regular people like us, just trying to figure it all out, right?
It is. I think when you're sold 150 biomarkers, unless you're able to interpret them, data that's not interpreted is just information that's not useful,
Yep.
right? So yeah,
Yep.
my position's a bit different. I think that companies are not just trying to make money, but they're trying to create more useful tools for us.
Mm.
So, uh, I think it's important to be able to interpret the results. So if a series of new results are easily or I'm able to interpret them, whether the company gives me guidance or it just makes sense because it's something that then it's useful. But like I'll give you an example, the gut microbiome
Mm.
tests. I don't know how to interpret them. I've never seen an interpretation that's meaningful uh, yet. I know other people do more deep work on it yesterday. I'm sorry. I know people do more deep work and might understand it better. But like for me, if a patient brings in this biome map, I'm like, I don't know. I don't know.
Yeah.
What are we going to change? I don't know. But
Yeah.
then similarly, I've had some really fun genomic studies that
Mm.
paper, to understand how people will digest certain drugs. And that's so interesting because then I could pick the drug better or understand what products might hurt my patient or help my patient. And then, similarly, like MTHFR is a genetic mutation that really helps with supplementation and understanding what you should be eating and looking out for. So I don't, I think for a primary care doctor, having 150 markers just often won't change what we do, which is
Yeah.
why that gentleman probably said that. And he's not wrong. But I
Mm.
don't know that getting more information and trying to add more is a bad thing, because in the 10 years I've been doing this, I do double the amount of blood work. But what I can tell you is everything that I order, I know what it's going to change in my management strategy. So I
Mm.
never start ordering something until I understand how it will affect what I do for my patient.
Mm.
And
So, what do you
if
think are the most important biomarkers then? I mean, I know a lot of us, again, they have a routine set, but understanding what you know now and doing all the research you do, and someone's listening and they're like, hey, probably cholesterol, these glucose, sugar, et cetera. But what do those look like? The really top ones we really have to pay attention to.
top ones to me is the triglyceride HDL ratio. And I
Okay.
think increasingly ApoB and LP little a are starting to fit into that. I think that an A1C and a fasting glucose without a fasting insulin is increasingly useless to me. I need to see
Mm.
the fasting insulin over time to understand what is happening, so I can understand, because there's a lot of folks developing type 1.5 diabetes where they don't have elevated fasting insulins and almost look like a type 1 diabetic, but adult onset, which is a new autoimmune condition that we're learning
Mm.
about. And there's some testing. Um, I think that like vitamin levels are important. I think vitamin D is a critical marker. I know some people don't think it's important. I think those people, I don't know what research those people are looking at, but for me, my vitamin D replete patients do so much better, and it's just an obvious one. Um, I use CRP. So this is maybe a weird one, but
Okay.
CRP is it's an inflammatory marker. It's very non-specific. But let's put it this way. If you have an infection, it elevates your CRP because it's an inflammatory marker, right? But let's say
Mm.
you don't have an infection and you're just like sitting there fine. You shouldn't have an elevated CRP. If I see an elevated CRP, I know something's wrong. Now, I can't tell you what it's wrong, but it sends me down a different cognitive path of trying to understand what's wrong. So some people will have an elevated CRP because they're so obese. And I will use
Mm.
the CRP to help guide them. Like, look, you lost 10 pounds, your CRP went down. Look, we didn't even hit your goal weight. We just lost 20 pounds and your inflammation went away. You know how good people feel about that? And you know what? It
Mm.
makes me feel good. CRP is also correlated with cardiovascular disease. So we know that if you're running a high CRP, it correlates with heart disease. Well, we know that heart disease is not caused by LDL. It's caused by inflammation. So I like an inflammatory marker like CRP. ESR, not always. If I'm suspicious of something autoimmune or a really bad inflammatory condition, if they've had a high CRP, I'll add the ESR. So inflammation, metabolic markers that are more subtle in the lipid panel, and then in the blood glucose world, adding that fasting insulin to better understand what is happening with the hormone part of it.
Mm. Okay. No, that's good because again, like we talk high level a lot of times, and then we miss some of these just quick takeaways for people when they're listening to really say, okay, these are the things I'm going to focus on. And the last thing on this, only because my nephew and all of his friends, if I hear about it anymore, I might go crazy, but I'd love to get your thoughts on it, which is testosterone, testosterone replacement therapy, all of this. A lot of guys are asking for TRT, and I think you emphasize more, root cause first, right? Like sleep, resistance training, nutrition, stress. Maybe talk about that because I hear it everywhere, and I'd love to get further clarification on that. And again, this is situational. We can't just paint it with a broad stroke, but yeah.
But yeah, very popular right now. Um, okay, let's start with, we know that there's a dramatic drop in testosterone levels over the last 50 or 60 years, compared to, say similar aged male 50 or 60 years ago had 30-40% more testosterone in their body. And we don't know why.
Mm.
Okay, I even did a great podcast with some sex doctors that are popular,
Mm.
whatever. and no one knows why. So the prevailing theory is phthalates, microplastics. There's a great study recently looking at biopsies of testicles, and they're all full of
Mm,
plastic. There's the perineum shrinking, which is thought to be related to
hmm.
microplastics. That's the space between the anus and the scrotum. Or
Okay.
so we don't know what's going on. So let's start there. Now, if someone has low, I love checking testosterone because I do think it's very useful. If a younger guy, so let's say younger, let's kind of make an arbitrary cutoff. Let's say like less than 35. Okay.
Okay.
If your testosterone is low and you're obese, well, you don't replace testosterone, you fix the obesity because that's the number one cause of low T. If you're taking a bunch of drugs like opiates, illicit substances, marijuana, which all of them want to pretend is super healthy. No, it creates not just testosterone problems, it creates fertility problems. Okay. So, yes, you have to address that. Now, as we get older, it becomes more difficult to make those changes. And I encourage my guys to make those changes. And I would say most of the time it does increase the test. But does it
Mm.
increase it to, it does significantly, but does it increase it to 7, 8, 900, which is where we should be living at? No, I haven't really seen that. My position on testosterone is if you're done having kids, and this is, by the way, completely personal. Like,
Mm.
I know people do it differently. I mean, people do a million things with testosterone. I've just decided what I feel comfortable with. And am I right? Am I wrong? I don't care. My patients do well, and I'm going to change my mind if I learn something new. So please take this with a grain of salt. If you're done having kids, if you're kind of over that 35, 40 marker, if I've screened your heart for any
Hmm.
heart problems like dilated cardiomyopathy, thickening heart, whatever, various heart issues. If your lipid panel isn't crazy terrible, um, I'm okay with replacing it, to be honest with you. Now, I target a physiological testosterone level. So I don't think it's appropriate for me as a primary care doctor to drive people's testosterone super physiological. Like men don't walk around with 1500 total T. That's not real. But most men on TRT that come to me from outside clinics are like 14, 15, 16, even 2000, right? So I'm not a fan of that because I think you're just doing drugs at that point. If you want to do drugs because you're a bodybuilder or you just like doing drugs, that's on you. And that's a separate thing. I actually don't judge people for that. I think adults get to make their own decisions on what they want to do themselves. So whatever. I don't do that in my clinic because I think it's like not safe. So I don't want to do something unsafe. Um, but I think if you're running 5 or 600, you've done as many things as you can. You're 40 years old and you're like, can we do a little T and get me up into that 900 range? I think that the outcomes are so good. And as long as they're doing it with screening the prostate, screening the heart, watching the hemoglobin, which is a real problem for TRT patients with elevated hemoglobins and hematocrits. So as long as we're watching for all those things, as long as we manage the dose, we do frequent blood work, we use some aromatase inhibitors, we, make sure that we don't have poorly treated, undertreated sleep apnea, just all these little subtle things, which isn't even that much. I think it's very safe. And that's what the research suggests. And I think
Yeah.
probably getting to the root cause is not just lifestyle. So here's the thing that people say, oh,
Mm.
you don't need to do it. You could just fix it with your lifestyle. Well, then why is it 40% down across the board? It's not, it's across the board, right? It's fit people too. We're doing something to ourselves that's outside of our control. We don't know exactly what it is. Maybe it's the Teflon chemical. Maybe it's
Mm.
the phthalates in all our plastic bullshit. We don't know. We can't control those factors. We definitely need to research it significantly and learn about it. Don't know if anyone's looking into it, but I
Mm.
don't think you need to accept a low T level. I think you're fine replacing it. I don't think you should take testosterone at 25. That's weird.
Yeah.
I think you should at 25 be working your butt off to get it up as best as you can and then deal with that and go have a family. And later, when you get into a different part of your life, we can make you feel younger and we can maintain that muscle mass and that sex drive and that vitality. And this goes the same for women. They're about to remove the FDA black box warning for female hormone replacement. Female hormone replacement should be a foundational part of what we do for women.
Mm.
If this is interesting, probably beyond the scope of this, but Dr. Marty Makary is one of the world's most important doctors. He is at heart, he is a safety physician. He does research on safety. He wrote a book called Blind Spots in 2024. And in 2025, Senator Kennedy made him the head of the FDA. So he is currently the head of our FDA. And so when people harp on things that they're up to, I'm like, don't harp, listen. That person Kennedy put in place has changed medicine and saved millions of human beings with the research that he's done. For decades, he's done this. And he summarized that in the book Blind Spots, which I encourage listeners to read. But if you know that to be the truth, then when you hear things changing in the FDA, instead of being upset, listen, because they're playing a 4D chess game with these insurance companies and these drug companies and with these highly ideological, politically driven humans that are essentially being manipulated to think one thing or the other. We need to step away and say, we actually have someone special in the head of the FDA. You're trying to do something special. And maybe he's not telling you exactly what you want to hear because he's got to play a very complicated game, very complicated. And so, like the Tylenol thing, I'm not going to get into it, but listen what they're saying. Listen, why would they say that? Oh, it's not just for fun. It's not just for fun. It's not because they're trying to make someone happy. They're playing a deep game, trying to navigate a complicated system. And I really hope people will do pay more attention to the nuance because they're trying to help. It's just not so easy when you've got billions and billions and billions and billions of dollars that you're battling because money
Right.
speaks much more. Okay,
That's right.
sorry.
No, but it's okay. I mean, and powerful companies, right? I mean, let's be honest. There's a lot of money behind these companies. There's a lot of power. It's a big machine you can be up against. And so, Dr. Marty Makary, Blind Spots, love it. And again, also what we're trying to do here, on DocPod and this specific show with DocStars is, I love it when I find people who are doing the research, evidence-based, data-driven. It's so easy to just hear people giving opinions and we all have our own opinions, but when it comes to this stuff, I just want as much data as possible, and then the right people interpreting that data, hopefully for us, right?
Yeah, and patience, because
True.
research science, evidence-based medicine, this is something that killed me a few years ago. The science is out. That's not a thing. That's not how science works. The science is not out on anything. At best, we have very strong, resilient theories that have been reasserted through many pieces of evidence, but science is in and of itself a question. It's always a question, and it should always be open to amelioration. Always. So if someone is very, very, very dogmatic, I hope that as people are listening, they can hear I'm not that dogmatic. I have ideas, but I'm not really. I'm like, prove me wrong. Let's go. I love it. I'm ready to change my mind if I can help more people and help myself and my family and my friends, right? But it's constantly a moving target, right? And so that is what makes it challenging for the layperson. But that shouldn't stop them from trying to learn.
Yeah. No, of course. I also want to talk about There's something that, I tell a lot of my friends and colleagues when they ask me, because I've been working out for a long time. I've been doing a very similar routine for 32 years, and we eat really healthy, my wife and I. And they tell me, well, which workout routine should I do? And I always tell them this, and I want to get your thoughts. I always tell them, listen, for me, having great lifestyle and being healthy for me is about consistency. There are a lot of ways that we can work out to be healthy, but I always tell my friends they're constantly jumping in and out of different ones. And I tell them, because I travel a lot for many years, I have to do something that works for me. Mine's different than you, but the best one for me is the one I can be most consistent with, and I really believe in that consistency. What are your thoughts there?
100% agree with that. And I would only add to that the one that brings you joy. Like
There you go.
it should bring you joy. Like
Yeah,
if you're miserable lifting, don't lift.
exactly.
If you're miserable running, don't run. The list of things you can do are hundreds of pages, right? It's
Exactly.
endless. If you love kettlebells, then do that. If you just want to do calisthenics, then do that. Or if you hate it all, get yourself a dog and take it for a walk 3 times a day.
Get outside.
Like
Yep.
there's just you got to do something. And if you're so miserable you don't want to do anything, then I can't really help you, right?
Yeah.
And you got to
Yeah.
go start working on the sleep part. And then you know what I mean? You got to actually go to the top of the pyramid and start working your way
That's right.
down, right? So,
And be
but yeah, I think
intentional, you know.
yeah, or just try new stuff, right?
Yep.
Because maybe you go out there and you play some pickleball and you're like, I love this, and now you play
Yeah.
pickleball 3 times a week, right? So,
Yeah.
so maybe that's it. But it's yes, what you said, consistency. But for me, it's joy. It should bring you
Enjoy.
joy.
Yeah.
Yeah.
Yeah. I also like what you said because, pickleball took off, right? I think during COVID and since then, which is amazing because we talked about social connection. And I think the more you can find things where you can get great recreational exercise, right? And you have social connection, for me, that's an amazing win. It's not just that you're playing pickleball. If you enjoy it, awesome. There's that joy you talked about. You're getting some good exercise, but you're also having social connection with other people, which again, I think the more that we are on this, that's so important, right?
Absolutely. And I know we're probably reaching the end here. I have to emphasize something. Uh, Maybe this is off topic, but I think it's probably
It's okay.
the thing. I think it's probably the thing that's missing in people's, especially young people today. And we're seeing a change, and I'm just gonna like frame it. I think spirituality is a cornerstone of health. I think for in many religions, the eating is part of the religion because it's a spiritual practice. Fasting is part of many religious practices. Uh, I think exercising and doing like team sports or even doing individual goal oriented things is a spiritual practice. I think I grew up in a time where religion was poo pooed and sort of our
Mm,
culture went away from it. Atheism became very popular, and I think it's led to a lot of problems that people refuse to acknowledge. I think we're seeing a society that's devoid of spiritual work. I think people have forgotten about God, whether it's God, God's spirit world, something higher. It doesn't matter what word you use. But I think if you're not making an effort to work on the thing that we have to believe in and have faith in and not have like a physical study that I can write, but rather prayer, vibes. People call it vibes now, whatever the words
mhm.
are. I think having a spiritual practice, whether it's meditating for 10 minutes a day, going to church or temple, reading a philosophy or a religious text just to learn about it, I think that that's why you see this resurgence of Christianity. I think there's a void in our society that is breaking us down mentally, emotionally, and ultimately physically. And I think that people need to acknowledge that spirituality is a foundational tenet of health. And it doesn't have to be, but is okay through religion. It could be through the local community. It could be through you getting together with your boys and not getting blacked out drunk, but actually sharing, right? It
Yep.
could be with your basketball team or your pickleball team. It could be with your close group of friends where you get together every Saturday morning and share your struggles, your victories. If we don't develop a spiritual practice, then we are susceptible to nasty like mind viruses that
Mm,
confuse us and make us unable to see what is truly important. It's an anchor. It's like a foundation. It's like a foundation in your house. If you don't have it, the rest of it is can float away. You can have this exercise habit or nutrition habit, and in a year it just floats away and you're like, what happened? I had it all down. What happened? Where did it go? It's because you don't have a spiritual practice. And it's hard because a lot of people have trouble with religion. And a lot of people, you know, overemphasize religion. So there's a balance here, right? It's
mm,
not all or nothing, but I think spirituality should start becoming a foundational part of all of us health people need to start emphasizing that. I don't have an answer for it. I have my version of it. I believe that the psychedelic medicine space is part of that, but I think that the religious space is part of that, and the meditation space is part of that, and the exercise space is part of that, and like it's all there. And if we start looking at it through that lens, we will have better outcomes, and our
yeah.
society can start to heal.
Yeah.
So
I mean,
honestly,
like you say, there's physical health, right? There's mental health, emotional health, and as you're talking about spiritual health, which is a great point. All right, last part I want to talk about, and then we'll wrap things up. I think the hardest thing that I see for some of my friends and different people that I talk to on this podcast is that establishing really great habits is hard, right? But it's so important because I think when we have these better habits, and we know when we have bad habits, it's even harder. But establishing great habits is difficult. So when we talk about going from like willpower to systems and technology, I like that there are a lot of ways to use maybe technology even to help us with this. So, why do you believe that accountability loops such as the in-app check-ins, right? The micro goals, some of the stuff that you can find in the coach app and other apps, these actually beat motivation for habit change, and because I think they're very powerful. What are your thoughts there?
yeah, anything that makes you accountable.
Mm,
Like, I don't know that there's. I love the apps. I love. Look, I love a pot. Like I listen to certain podcasts consistently because their messaging is consistent and it keeps me
yep.
super honest, right?
Mm,
Maybe at some point that was something that my podcast can do for people. I think that's what I try to offer with my frequency of visits. Anything that can make you accountable. I don't think I can't think of a single bad thing that makes you accountable. Maybe I can't, but like and maybe that's where the spirituality part comes from. Like that makes you accountable. Like if you have that community or that group or you have that meditation practice by yourself, well, that is an accountability mechanism in and of itself
mm,
because it grounds you and you can't ignore. Like I think a lot of accountability actually is slowing down and like not doing the next thing, but actually thinking about what you're doing. And like, so the app, you have to stop. You have to look at, okay, I did this last week. I did this
mm,
run 2 days ago. I'm due for my run. You know,
yep.
I, I always say like, it's hard for me because I am the person that makes everyone accountable. I make my business, my patients, my community is my accountability because I can't get unhealthy. I'm this guy. I'm this guy. I have to be this guy. It's when I see a really unhealthy doctor, I'm like, what are you doing? How can you help other people? Let's gotta help yourself first. So yeah, I don't know if that answers your question. I think
Yeah.
whatever way you can be accountable is how you got to be accountable, and even if it's unpleasant, for the record.
Yeah. And there's lots of different ways to find that accountability, like you say. So if it helps, and we're all different, it's fantastic. So let's wrap up and give everybody what we call our clear signal, which is that long-term health isn't found in a single pill, a protocol, or even a hack. We always hear that today. It's really built by stacking fundamentals, including sleep, which we talked about today, so important at the top of the pyramid, protein-forward real food, resistance training, intelligent fasting, recovery, and of course, labs, as we know, all wrapped into a repeatable weekly cadence. That consistency is really, really important. We know that technology and coaching can make that cadence stick, but the transformation happens when patients actually own the process and clinicians measure what matters. So thank you, Dr. Gary Schliffer. Your Playbook has been amazing. Thanks for joining us today.
Thank you so much for this conversation. It's been a pleasure.
I loved it. I love deep diving with you. Hopefully we can do it again. A special thank you again to Dr. Gary Schliffer of course, Evolve Healthcare, the founder and the former host of Sapien Podcast. And who knows, maybe he'll bring it back, but it's out there if you guys want to check it out. Please like and subscribe as always, so we can bring you and continue bringing you these incredible doctors. Again, follow us using @ or hashtag DocPodHealth and the DocPod channel, because health, it is everything. Thank you, everyone.
Celebrating the world's best. This is DocPod's Doc Stars.